On this episode...
Oh goodness me. At this stage I don't really know what it is. I'm not really sure how I will take this off because it looks like it's almost part of the pad. It's pretty nasty, isn't it? It might be that I have to rethink my option, and that unfortunately might be having to remove her toe, which I really don't want to do. Hello. Oh, Nala. I'm feeling a little bit nervous because right there is a nice big vein. It's a bit scary, this.
But first...
She's had it for a couple of weeks, and obviously I was a bit shocked, concerned, because I don't know what it is.
Because it's growing, I feel like we should take it off. I'm really fond of Miko, and I've got a lovely relationship with Miko's mum, Ali. So there's a lot of pressure. Right, first incision. Yeah.
And the panting, obviously just a bit stressed, but has she been panting a bit more at home as well?
In the UK, another busy day is underway for Louisa at the White Cross Clinic in North Yorkshire.
So she's got a cellulitis there, which is infection under the skin from dog bites.
That's why. Pets are so important because I've seen relationships that mean so much to somebody, and I've seen these pets bring owners through terrible times, and the bonds that they have and what these animals do for their owners, but vice versa. It's just so special.
Come on, Mika. Good girl. Good girl.
And one special partnership is Ali and her beloved 12-year-old Springer Spaniel, Miko.
Good girl. Oh, Miko means the world to me. I've had her since she was 10 weeks old, and she just comes everywhere with me. She's just my perfect dog. She comes to the beach with me all the time, so yeah, she's just my baby, to be honest. She's a massive part of the family for all of us. She means everything. Good girl.
But Ali is extremely worried. She's hoping Louisa can put her mind at rest about a sudden and fast-growing lump on Miko's left side.
Good girl. She's had it for a couple of weeks, and obviously I was a bit shocked, obviously concerned, because I don't know what it is, and obviously you associate lumps on dogs, don't you, with sort of nasty things that you don't want. So I was just a bit like, oh God, what is it? Do you know what I mean? Obviously you don't want it to be anything bad. It just means everything to me. I just want the best for her.
Right, so we're going to go and have a look and talk about this lump, aren't we?
Yes.
Right. Miko, you've not got your bells on. Do you want to come into my room? Come on, let's go.
Come on. Go.
I'm really fond of Miko, and I've got a lovely relationship with Miko's mum, Ali. We've just built that relationship, and it means that she knows that I would treat Miko like my own dogs. So what I'm feeling for here is how big it is, and I'm putting my hands underneath it to see if it's attached to underneath. Now, as you can see, it's quite mobile, but it is quite a big one. And the thing with lumps is that you can have non-cancerous benign lumps that we still need to remove because they're growing and bothering them. And I think it's clearly bothering you. So because it's growing, I feel like we should take it off. Even though you are our golden oldie, you know, we still need to take things off and address things when they do become a problem.
But an even bigger problem is that Miko has heart disease.
But I think, you know, all things considered, because she has a heart condition, what I would recommend is that we check that she's fit and well enough to have her procedure.
That's fine. But obviously, it's concerning when she has to have an anaesthetic with the heart and things.
I know. And and I know how much you care about her. I know. I think Miko's mum's going to be really nervous at home. She'll be really stressed and anxious. So there's a lot of pressure when somebody cares so deeply about their pet, but that is ultimately the reason why I do the job that I do. Come with me. Thank you very much. Come on, darling, say bye to Mummy. Come on then.
Yeah,
she's not going to come with me now. Come on, Miko.
Thank you, Louisa.
You're all right. Good girl.
That's the hardest bit, watching her go out. But yeah, I already feel sad, but I'll just wait for her to come back.
Good girl, good girl. That's it, right.
Louisa is conducting an ultrasound scan on 12-year-old Miko's heart to make sure it's safe to do surgery to remove a potentially cancerous lump growing on the spaniel's torso.
Excuse me. We anaesthetise pets with heart disease all the time. We just do what we can do to make sure that they're in the most stable condition possible, essentially. And that's what we're doing for Miko.
If Miko fails her heart exam, it will jeopardise plans for immediate surgery.
What we're looking at here is the left side of her heart, and this is the right side of her heart. And we're kind of looking at the way that the heart moves, checking that everything's working okay, and so far everything seems fine. So I feel reassured that she is going to be fit enough for her anaesthetic. The heart disease hasn't progressed since I scanned it last time, so I'm happy with the anaesthetic protocol that we've done. And yeah, I'm pleased.
It's a great result. Nurses Hannah and Ali will now prepare Miko for immediate surgery.
Right, are we ready? We give her a little bit of one medication, we give her a little bit of another, and she'll hopefully just nicely fall asleep without feeling too strange. All good, yep. We'll keep listening to it throughout and check that, you know, her heart rate's not going too fast, too slow, and things like that.
Heart rate's staying quite stable, her respirate is pretty nice as well, and her blood pressure's staying nice as well, so pretty happy with her at the minute, but we'll just continue to keep an eye on her just in case she throws any curveballs at us. You should be thinking about what could go wrong, because then hopefully nothing does go wrong.
Right, first incision.
Yeah.
It looks like a big collection of fat, but the problem is it's quite attached at the bottom. So what we're going to do is try and go around it.
Nurse Hannah is closely monitoring Miko's delicate heart condition under anaesthetic, as Louisa begins tackling Miko's worrying lump, fearing it could be cancer.
Let's say this is hopefully the benign just collection of fat, they can grow back. And so I really wouldn't like Miko to have another surgery if we can avoid it. So I'm going to try and take off safely as much as possible. But also it's attached to the abdominal muscles, so if I went too far I could actually damage her abdominal muscles, which we obviously want to avoid. They can be quite vascular, these tumours. They often have lots of blood vessels that supply the mass, and you can easily nick one, and often you just have to try and find them if you can do and stitch them, otherwise it's just a case of trying to avoid them if you can. You don't always know where they are, so you've got to be really careful and sort of dissect down slowly rather than just cut willy-nilly and then you've got a bit of a bleed. Much harder to fix when you've got blood spurting everywhere, so you've got to be delicate. Right, so I think we are ready to...
And finally, much to Louisa's relief, the nasty mass is out.
Good, good. This is my favourite part of taking lumps and bumps off, is stitching it back together again, because I just find stitching really relaxing. And you know that you've done the most stressful bit, now you're just making it look pretty. And that is us done. Good girl, Miko.
She sailed through her anaesthetic, which is good. Really happy with how she did. Now she just has to wake up, eat some food and go home and rest.
I'm pleased with how today's gone. I'm really fond of Miko. I'm just glad that she sailed through her anaesthetic and she's woken up really quickly and she's ready to go home, so I'm pleased.
It's now an anxious wait for lab results on the lump to show whether or not Miko has cancer.
There we go.
4 hours later, Miko is ready to go home, and adoring mum Ali is anxious to be reunited with her beloved Springer Spaniel.
I just can't wait to see her. I'm so excited to see her, but obviously I'm like, oh God, I hope she's okay. So I just can't wait to see her, to be honest.
Hello. Look at you.
How she is.
Hello, Liz.
How are you?
Oh, is she? So brave, Miko.
And Miko is so excited, she can't keep still.
Oh, we haven't yet.
Hey, you.
And she's desperate to go back.
Oh, bless her.
She was perfect. She was beautiful. Reuniting Miko with her mum, that response, that moment is the reason why we do what we do. Thought you might want to see that. So yeah, that was what was on the side of her.
I can't believe that was like inside her. Ugh.
Yeah, so we will send that off to the lab. It's not something that you probably want on your shelf, no?
I know.
No.
Both Ali and Louisa will be on edge until the lab results confirm if Miko has cancer or gets a clean bill of health.
TLC, rest tonight. She's not eaten anything yet. She can have a small meal.
Thank you so much, Louisa. Okay, thank you so much.
You're welcome. Bye,
Thank you,
Miko.
bye. Good girl. Come on, Miko, let's get you home. Good girl.
Good girl, come on.
Louisa's next patient is a clinic regular, 7-year-old Pomeranian Chihuahua cross Nala, owned by veterinary care assistant Becca.
Good girl. We've had Nala since she's a puppy. She has kind of been a problem dog. So we found out she was epileptic when she was about 1. She's had both of her patellas done. Then she had an ulcer in her eye. She had some teeth taken out, and then when she came round from some anaesthetic, she ran into a door and then knocked a few out as well. So she's always in here. We walk through the door and everyone knows who Nala is, yeah. But we love her. My sister and me, this is like our life, so we'll do anything for her.
But this isn't a social visit. Accident and illness-prone little Nala has a new problem.
We found a little mass in the side of her mouth. It wasn't bothering her at first, but it has kind of grew. She kind of chews on it. So hopefully Louisa can kind of either remove it or stop it from growing.
Hello, Nala.
Hello.
Hello. Sorry. So
Yeah, so there's a small one on that side and then there's a lot larger one on that one.
So you can see it poking around the corner there. Nala has a condition called chronic granuloma, but it's also known as gum chewer syndrome, where she just catches the tissue around her tongue every time she chews.
Yeah.
And it gets bigger and more inflamed, and then it's this perpetuating cycle where every time she eats, she chews it, and then it gets bigger and inflamed, and then because it's in her mouth it can get infected. So we will have her under anaesthetic, and then under anaesthetic I'll be able to have a much better check over, because naturally she doesn't really like me looking at her mouth when she's awake. It's quite hard to examine the inside of anybody's mouth, so the only way that I can do this properly is with Nala fast asleep, under anaesthetic, where I can open and close her mouth and do a little bit of prodding and poking to see what we're looking for. This gum chewer syndrome, do you think it's got worse?
It depends on the day. So usually sometimes when I'll have a look, it's either red and ulcerated where she's been chewing it a lot, but when she's left it alone, you can see just a lump in there.
So the plan is that we will put her under anaesthetic and hopefully remove as much horribly thickened tissue as possible and stitch it back. But if I feel like the tissue has become too inflamed or infected, or I don't feel like it's the right thing to remove today, we'll wake her back up and make a surgical plan for another day. Yeah. Ready to induce?
Yeah.
You have a little snooze, Nala.
It's always nerve-wracking, obviously, when they're going under. She used to go in for operations and I'd sit in the waiting room and kind of cry, but you have total faith in like these guys that they know what they're doing.
Sorry, Nala.
The look.
Right, are we ready to have a look at what we're dealing with?
With Nala now fully anaesthetised, Louisa can get a closer look at the damaged tissue inside the 7-year-old's mouth.
You can see that it's all very thickened and quite nasty looking, and when you open and close her mouth you can actually see where her teeth are almost rubbing and catching on it, which is why it's called the gum chewer syndrome condition, because every time she closes her mouth this piece of tissue is getting stuck in her mouth and it just gets worse and worse and worse. So the aim is that we try and cut that off and she's got nothing to bite, and then hopefully it resolves. This lesion on the side of her tongue, it's now just really uncomfortable for her. She's starting to show signs of difficulty eating, and it's time to get this removed now.
But because Nala is epileptic, she's at greater risk under anaesthetic. So Louisa checks her tiny patient to make sure it's safe to start surgery.
Lovely. Just doing a heart check there, which is fine. Certain medications can, what we call, change the threshold to seizure, so it can put them at higher risk of seizuring, but we're going to avoid all those medications today.
Also worried how her much-loved pet will cope under anaesthetic is Louisa's workmate, Becca.
I'll probably be peeking through the window at times, but yeah, I'm nervous about it. But being in here, you kind of see how much they do care. I have full hope in Louisa. I trust her with her.
When it's a staff and a friend's dog, you do feel that little bit of extra pressure, but also it is quite nice that she trusts that we'll hopefully do a really good job and look after Nala. It is nerve-wracking when you're bringing your own pet in. I have operated on all of my pets, and it can be quite hard to remain focused and objective, so I try and take off the load from the other team members when their pets are ill, because it's not nice making decisions on your own pet. It's actually quite upsetting. The tricky thing is how we're just going to keep her mouth open. I'll probably have to get someone to open her mouth for me to be able to do it.
Senior vet Alex arrives to provide the extra pair of hands needed to remove the troublesome growth from Nala's mouth.
If you hold the mouth open, it's perfect. Can you hold the bottom jaw for me?
Squashing it, isn't it?
Because the lingual vein is there. It's a bit scary, this, because right there is a nice big vein. You can see this big vein going down the side of the tongue, this sort of lingual vein. It's kind of off-putting whenever you see big vessels, because you spend half the time trying to make sure that you're avoiding it whilst also trying to do your job. I think it's just going to be steady, steady, steady. I do expect a little bit of bleeding, but hopefully nothing too dramatic.
Surgery to remove the irritating growth from Nala's tongue is proving tricky for Louisa, as she tries to cut close to a large vein.
I am trying to find a way to just kind of isolate the growth to avoid the big blood vessel. So the way I think I'm going to do it is just put some stay sutures on, and Alex to help me hold it up, and then we'll just slowly cut.
Louisa sews stitches into the 7-year-old's tongue, which will act as handles for Alex to elevate it.
It's like microsurgery in a tiny dog's mouth.
She can now safely access the tissue that needs to be cut off.
Yeah, that's the vessel there, so I feel like it's...
You can almost see through the tissue.
But it's just there. It's quite unnatural doing things in a mouth, and also Nala's quite small, so there's not that much space to deal with.
Size is also proving a problem for Louisa, with her much taller colleague.
I have to have the table lower, because I am smaller.
You could put the table up and get you a stool, and then that would...
Cheeky.
I'll just crouch down.
So you can see already that is the tissue that we're having to get rid of, and when it's stretched it doesn't look as thickened, but you can see this really sharp molar down here is the one that is basically getting almost stabbed into there every time she chews. So the aim is to try and get as much off as possible.
As long as you're happy up near the...
Vein's down there, isn't it?
Mm-hmm.
So I think that's it all out, isn't it?
Finally, the painful, damaged tissue that has distressed Nala for weeks is now gone.
I think that should be all right. I have got most of it off. It looks a bit gross, and I can see where it would be quite sore for Nala. So I want to make sure I don't leave anything extra that Nala could just restart chewing to make us go through all of this again. So I'm just taking a little bit extra just off the edges, just before I stitch it all back up. So we're just stitching up now, and then hopefully when she wakes up, she'll feel a lot better.
How's she getting on?
Oh, she's doing really well. So we've taken most of it, because I feel like it's come off nicely. So fingers crossed that's done the job and it makes it feel a bit nicer.
An anxious Becca has dropped by to see how the little dog she's raised from a puppy has responded to surgery.
Yeah, I'm quite pleased with that. I think that should be okay now. Right, and we just wake her up.
But because Nala suffers from epilepsy, waking her up is a perilous procedure in itself.
Recovery is quite important for any pet, but particularly those with epilepsy, because in that post-operative period is when we could potentially start seizuring. What we'll do now is just turn the lights off, so when she wakes up, she's not, being stimulated too fast, too quick, because that can be what can trigger seizures. Oh, Nala. She's just waking up now.
Are you with us?
Nurse Becca is keeping an anxious vigil as her epileptic dog Nala slowly wakes from surgery on her tongue.
So we're dimming the lights, we're keeping it nice and calm, and that's why I've got Becca to come back in. So Nala's got a familiar face, and I'm sure that would have been perfect for Nala to see her mum wake her up.
It's always a relief when you see them opening their eyes and coming back round. Hello. Hey. She's like, I'm ready to go now. I'm happy with what Louisa's done. Yeah, so.
Oh, Nala. It's not a good look, Nala.
Really not. Good girl. Come on.
Night, night, Nala.
Come on. Can we pop you back in here? There we go. Should we pop you back in there?
Becca and Louisa will continue to keep a close eye on their patient to make sure she doesn't have a seizure while recovering from her anaesthetic.
I'm here. Oh, good girl. Hey.
That's a nice face to look up to, isn't it, your mummy?
You're going to stay there. Good girl.
She's actually awake really quickly. So Becca feels relieved. I'm relieved it's the end of procedure, and then we'll just get her home. That's very, very cute. So you can see what Nala means to Becca. That's very cute. So we have to look after her. Extra VIP. Come on then. Come on then. Oh, you're a good girl, aren't you?
Before long, Nala is fully recovered and ready to go home.
Hello.
She's recovered really, really nicely, so we've not had any seizures. She doesn't need antibiotics or anything, just TLC at home. The plan for Nala is just to go home. No doubt she'll be spoiled, having lots of cuddles, and hopefully she wakes up tomorrow and she's absolutely normal. You certainly look better.
Yes, you do.
And yeah, she doesn't want that to grow back again, do we? You want to go home, don't you?
Yeah.
You want to go home.
Right, thank you very much.
Oh.
Off we go. Come
Bye.
on then.
Bye,
Let's
Nala.
go.
Bye.
Come on then. Let's go. Let's go. Good girl. Come on.
Good girl. You are behaving beautifully.
Jackie's come to Louisa's Yorkshire practice, worried about an issue with her 2-year-old Springer Spaniel, Freya.
Good girl. It looks a bit like sort of cauliflower, actually, and she limps on it or holds it up. You can tell after a walk she's a bit less inclined to put her weight onto it.
Freya, please.
Come on, Freya.
Come on, sweetheart.
Come on. Good girl.
So I really like Jackie because she's spaniel mad, just like me. I have a cocker spaniel and Jackie's got 5, I think, spaniels. So she absolutely loves them and she will do anything for them.
Good girl.
Right.
This foot here. Good girl.
Oh, goodness me. It's not small, is it? It is quite warty and it's annoying that it's attached right on the side of her pad, which she probably has been licking this foot because you can see inside it's quite red and sore. And when did you notice that she had this lump?
About a couple of weeks back now. She did cut it, but it healed up very quickly. So whether something went in or whether she got an infection in it, we don't really know.
It does look like maybe a viral warty growth or
Maybe,
something.
yeah.
Freya, is it bothering you?
You don't know with dogs really, they
No.
don't always let you know that they're hurt.
No.
Freya's just fabulous. She loves running, she loves the ball, she loves just everything about life. We love her, and my husband absolutely worships the ground she walks on.
It's not a toe and a pad that is the most important. The other two are, but we want to try and save this pad.
Yeah.
So what we'll need to do is have her under anaesthetic,
Yeah.
and I will aim to cut it out and try and get rid of it all. At this stage, I don't really know what it is because I've never seen a lump like this. It's a weird one. It's just attached to the foot pad, which makes it a little bit more tricky because you can't see exactly where it starts and where it ends. All I know is that we just need to get it off because it's affecting Freya's walking. Right, it's time to come with me.
Okay. Come on, sweetie. Good girl.
She's not gonna move
She's
now.
quite laid back.
Yes, I'll look after her. She's got a nice bed. Do you want to come with me and say bye to Mum?
You get very attached, don't you? Particularly when you haven't got any children at home anymore, they become part of your life. So I'm nervous about it because we love her and we don't know what's going on.
Come on then. Come on then, see you soon.
Thank you very much. I'll see
Come
you
on.
later.
You're a good girl, aren't you? All right, little poppety poppet. Are you happy? I'm not really sure how I will take this off because it looks like it's almost part of the pad. So we'll just have to go slow and steady. The main thing is we need to get it off because it's just, imagine walking on a ball all the time. It'll be very uncomfortable. Sweet dreams, Freya. So as I'm sort of getting ready for surgery, we've got to figure out how we're going to take this lump off. We've got to try and get it all off, try and close the gap that we make when we're removing it. We've got to figure out whether we can actually take it all off. I'm just trying to figure out a way to take it off and close it, but also not have to damage the pad, because you don't want to have big open wounds, but I need to have enough skin to close the wound ideally. So in my head, I'm trying to work out all possible scenarios, which unfortunately includes, do I need to remove this toe to get the best outcome and the quickest outcome for Freya, which obviously I don't want to do, but you know, at this moment, I'm thinking of all the options. But I won't really be able to fully figure this out until it's all clipped and shaved and, you know, when she's fully ready to go. Right. I'll put some local in.
So I've had to like shave on the top as well.
Like, what, I don't know what skin I'm gonna...
What you're gonna have left.
Louisa's now starting to doubt if she'll be able to remove the nasty lump from Freya's foot and save the young spaniel's toe.
You could actually remove the toe, which sounds really drastic, but sometimes for that particular pet it's the right thing because it's actually the quickest way that they return to normal life, but I don't want to make this dog's life worse. It's a bit of a tricky growth. It's kind of all the way around the toe, so I'll have to be moving the toe in between.
Louisa finally has a plan and is about to start the tricky surgery to remove the awkward lump on Freya's foot.
It's pretty nasty, isn't it?
It's a bit gross.
I really don't want to just lose the toe, but it actually goes like quite deep under the skin and tracks up a little bit. Right, we're just gonna have to go. You will not want to walk with this between your toes. So my plan is I'm going to try and take it all off and see what I'm left with. And if at all during this I think that I'm going to make Freya worse by leaving a wound that might not heal or require lots and lots of bandage changes, then it might be that I have to rethink my option, and that unfortunately might be having to remove her toe, which I really don't want to do. Just trying to separate it from the pad to start with to see how much of the pad is involved. I'm going around it as close as I can do to figure out how far it goes in, and then I'll try and figure out how to close it after this. But I'm almost about to take it off now. It looks like I'm going to be able to remove it all and stitch it back together whilst saving the pad and saving the toe, which is the most important thing. So I'm really pleased. So that's it off. It's actually come off quite nice, but what I need to just try and make sure is that I'm not leaving any of the growth behind, because that's unfortunately how sometimes they grow back. Is she okay? So it's starting to look much nicer than it did before. Not that Freya can see it. Just the last stitch, and then we'll get it clean. Good, all done.
It will be an anxious wait to see if the lump is cancerous and how well Freya walks on her reconstructed paw.
As soon as she wakes up, we'll get home, which is exciting.
Four hours later, Freya is fully awake after her foot surgery.
Normally our pets recover in their kennels. Freya doesn't really like being in the kennel, so she's been taken out, she's been in the prep area, she's been in the dispensary, she's been in the staff room being looked after, so she's been spoiled rotten.
The great news is Freya's walking perfectly normally after Louisa removed the large lump from her hind paw. Freya's devoted mum Jackie is keen to see her precious girl.
Oh, I'm really excited to see Freya. She's such a sweetie and I can hear her, so she's clearly all right.
Look, he's clean! Yes! She sailed through it. She's been absolutely fantastic.
Much better. She'll be glad to get home.
I think she missed you. Oh, you missed her.
I missed her. Yeah, she just would have been a bit annoyed.
It's really nice to reunite her with Jackie because I know how much Freya means to Jackie. We're going to be waiting for the biopsy results, and fingers crossed the biopsy comes back that everything was benign.
Yeah.
And hopefully it comes back that we've got it all.
Right.
I've got a bit of a soft spot for Freya, so I feel like Freya deserved the top dog bandana today. It's a nice little gesture to go home with. You've got your top dog. You've got your top dog bandana. She's been spoiled. She's ready to go home now. Yes.
Just wants to go home, I think. Come on.
Freya, it's home time.
Just go.
Lovely. We'll see you later.
Thanks.
Bye. Bye.
Bye, thanks very much.
You're welcome. See you later.
Come on, Freya. Good girl.
Test results on the lump Louisa removed from 12-year-old Miko showed the growth was cancerous. Thankfully, they also confirmed that all the malignant tissue was successfully cut off. The friendly Springer Spaniel is back at the beach with her best friend and surfer mum Ali, as both make the most of Miko's new lease on life.
Good girl, there we go, good girl.
A week after surgery on her tongue, Nala is pain-free and eating normally. Becca and Louisa are continuing to carefully monitor the 7-year-old's progress. Hopefully the chewing disorder is now a thing of the past. And after Freya's surgery, test results revealed the nasty-looking lump taken from her paw was not cancerous. The lively 2-year-old is back to full health and enjoying life to the full.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.